Hi, good day. My name is Jason Lumag from BSMT2B.
I'm Ivy Lopez from BSMT2B.
Our topic for today is cardiovascular disease. We discuss different types of cardiovascular disease, symptoms, causes, and treatments.
So, what is cardiovascular disease? According to World Health Organization, cardiovascular disease or CVD is a name for the group of disorders of heart and blood vessels and includes hypertension, coronary heart disease, and cerebrovascular disease. Cardiovascular disease is most commonly illness to the elders. And today, some people have diabetes, hypertension, smoking habit, overweight, and it can be inherited. There are different types of cardiovascular disease. Congenital heart disease, coronary heart disease, cerebrovascular disease, peripheral arterial disease, rheumatic heart disease, and deep vein thrombosis and pulmonary embolism. First is rheumatic heart disease. It is a chronic condition resulting from rheumatic fever that is characterized by scarring and deformity of the heart. The symptoms of RHD: fever, swollen, tender, red, and extremely painful joints, nodules, shortness of breath and chest discomfort, uncontrolled movements of arms, legs, or facial muscles, weakness, shortness of breath, chest pain, and swelling. The causes of RHD is caused by rheumatic fever, an inflammatory disease that can affect many connective tissues, especially in the heart, joints, skin, or brain. The heart valves can be inflamed and become scarred over time. This can result in narrowing or leaking of the heart valve and making it harder for the heart to function normally. This may take years to develop and can result in heart failure. The treatments. The best treatment is to prevent rheumatic fever. Antibiotics can usually treat strep infections and keep rheumatic fever from developing. Anti-inflammatory drugs may be used to reduce inflammation and lower the risk of heart damage. Other medicines may be needed to manage heart failure. And to the people who have rheumatic fever are often given daily or monthly antibiotic treatments, possibly for life, to prevent recurrent infections and lower the risk of further heart damage. To reduce inflammation, aspirin, steroids, or non-steroidal medicines may be given.
So, coronary heart disease, a disease which there is a narrowing or blockage of coronary arteries or blood vessels that carry blood and oxygen to the heart. Coronary artery disease is usually caused by atherosclerosis, a buildup of fatty acids and plaque inside the coronary arteries. The symptoms are chest pain or discomfort, weakness, lightheadedness, or nausea, pain or discomfort in the arms or so coronary heart disease. Treatments are quit smoking, eat healthy foods, exercise regularly, lose excess weight, reduce stress, cholesterol modifying medications, aspirin, beta blockers, calcium channel blockers, ranolazine, nitroglycerin, angiotensin converting enzyme inhibitors. Treatments are quit smoke. And the causes of coronary heart disease is by plaque built up in the walls of the arteries that supply blood to the heart, and plaque is made up of deposits of cholesterol and other substances in the arteries. So, congenital heart disease. This includes primarily anatomic abnormalities present at birth that results in abnormal cardiac functions. And the symptoms are bleeding to the skin or cyanosis, rapid breathing, rapid heartbeat, swelling in the legs, tummy, and around the eyes, shortness of breath in babies during feeding, extreme tiredness and fatigue, fainting during exercise, swelling. So congenital. First, we have catheterization method. This can often be used to fix holes or areas of narrowing. And the second one is open heart surgery. This depends on the child's condition, but many congenital heart defects are corrected using this surgery, the open heart surgery. And heart transplant. If heart defect can't be repaired, heart transplant is the best. And the treatments are so cerebrovascular heart disease. The term cerebrovascular disease includes all disorders in which an area of the brain is temporarily or permanently affected by ischemia, or bleeding of one or more of the cerebral blood vessels are involved in the pathological process. And the symptoms are dizziness, nausea, or vomiting, unusually severe headaches, confusion, disorientation, or memory loss, numbness, weakness in the arm, leg, or face, especially just one side, abnormal or slurred speech, difficulty with comprehension, loss of vision, and loss of balance. And the treatments are medication, anticoagulants, blood pressure medications, cholesterol lowering medications, cerebral angiography, neurosurgery, TPA, carotid endarterectomy, and the treatments are medication, anticoagulants, blood pressure medications, cholesterol lowering medications, cerebral angiography, neurosurgery, TPA, carotid endarterectomy, carotid angioplasty and stenting. And the causes are stroke,
Peripheral arterial disease. Peripheral artery disease is also likely to be a sign of a buildup of fatty deposits in your arteries, or atherosclerosis. This condition may narrow your arteries and reduce blood flow to your legs and occasionally your arms. PAD most commonly affects arteries in the legs or lower extremities. Is the narrowing or blockage of the vessels that carry blood from the heart to the legs. It is primarily caused by the buildup of fatty plaque in the arteries, which is called atherosclerosis. PAD can happen in any blood vessel, but it is more common in the legs than the arms. The symptoms of peripheral arterial disease is hair loss on your legs and feet, numbness or weakness in the legs, brittle, slow-growing toenails, ulcers, open sores on your feet and legs which do not heal, changing skin color on your legs such as turning pale or blue, shiny skin, for men, erectile dysfunction, the muscles in your legs shrinking. The causes of PAD is smoking. It is the most significant risk factor. Type 1 diabetes and type 2 diabetes with high blood pressure, high cholesterol, and growing older. For the treatment, there are some medication, and angioplasty and surgery. For medications, cholesterol-lowering medication, high blood pressure medications, medication to control blood sugar, medications to prevent blood clot, symptoms relief medications. For angioplasty and surgery, there are three types: angioplasty, bypass surgery, and thrombolytic therapy. For the last is deep vein thrombosis. Deep vein thrombosis or DVT is a medical condition that occurs when a blood clot forms in a deep vein. These clots usually develop in the lower leg, thigh, or pelvis, but they can also occur in the arm. Deep vein thrombosis and peripheral arterial disease is also the same because it's commonly found in the legs. But the DVT is occurs in vein, which is carries oxygenated blood back to the heart, while the PAD is occurs in arteries, which is carries the oxygenated blood away from the heart. Symptoms of deep vein thrombosis: swelling in the affected leg. Rarely, there's swelling in both legs, like this. This. Pain in your leg. The pain often starts in your calf and can feel like cramping or soreness. Red or discolored skin on the leg. And last, a feeling of warmth in the affected leg. For the treatment of DVT is to prevent the clot from getting bigger, prevent the clot from breaking loose and traveling to the lungs, reduce your chances of another DVT, blood thinners, clot busters, filters, compression stockings. And it causes anything that prevents your blood from flowing or clotting normally can cause a blood clot. The main causes of DVT are damage to a vein from surgery or trauma, and inflammation due to infection or injury.
So, what did you learn? Una, tatandaan nyo, heart disease prevention is a major health concern worldwide, and it is vital that people learn to identify and manage heart disease risk factors. Must do to prevent cardiovascular disease, healthy eating, regular exercise, and see a doctor to measure your blood pressure. Don't smoke, avoid high cholesterol foods, manage your weight, get enough sleep, be stress-free, limit alcohol, drinks, and always be happy. So, what did you learn?